Uniten, please note your setup time has started.
The array of human potential is bundled into one mortal body.
Though ideally, we should be our own catalyst.
But to precipitate, we need external guidance and the occasional extra push.
So that bundle would burst, materializing into its potential of being
self-reliant,
self-assured,
and surprising,
independent,
and eventually successful in our own right. Good afternoon, I'm Ashley.
I am Aravinda.
I'm Firdaus.
And I'm Shahira. Together with our report and technical team, we are
Enactus University International, KSHAS. This year, 32 students worked over 7,779 hours in 2 projects, impacting 20 Malaysians directly and 3,383 Malaysians indirectly.
For the purpose of today's presentation, we shall take you through 2 of our prime projects that have generated significant growth this year, Mukutrapolis and REAMP.
For easy comprehension, all Enactus elements met shall be visible on the right-hand side of the screen.
Last year, Malaysia was host to over 25 million tourists, of which over 200,000 came to the island of Tioman.
Our point of interest, Mukut, a humble, forgotten village with authentic village charm, received only about 1,000 tourists last year.
Mukut village is approximately 2 hours via ferry from Mersing Jetty to Genting village. From there, visitors are required to take a water taxi to Mukut village. The whole island of Tioman has over 3,000 population, but Mukut village has only about 100.
The only transport between villages is via water taxi. They have no proper land transportation. During monsoon season, Mukut would be cut off, and transportation via water taxi would be impossible. This certainly reduced traffic to Mukut for locals and tourists alike.
The village has only 4 chalets and 2 shops. The source of income for this village would be either from fishery or working in chalets as housekeepers, tourist guides, cooks, and owning small shops.
Their average monthly household income is 563 ringgit, below the national poverty line income. During the northeast monsoon season, fishing is impossible. The villagers would have to seek for jobs in the village or elsewhere, or depend heavily on their savings from November to March.
Due to lack of job opportunities in Mukut village, urban migration is unavoidable. Due to this income depression, older generation has resorted to selling their land and leave Mukut village in search for a stable life.
Based on our assessment, we have derived that the villagers need to generate income from their homes that is not too capital consuming and easily maintained.
This brings us to our solution. During our first engaging visit back in April last year, we stumbled upon a large colony of trigona bees. Due to Mukut's geographic region and lush forest vegetation, occupying over 60% of the island, the bee's habitat flourished.
Its honey is scientifically proven to boost metabolism, preserve beauty, and treat internal diseases such as diabetes, hepatitis, and cancer. According to Associate Professor Dr. Siti Amrah Sulaiman, who is a leading honey researcher from University Science Malaysia, these trigona bee species are slightly different from ordinary honeybees.
Exactly. 1 kilogram of its propolis can fetch over 1,000 ringgit, and 100 grams of honey as minimum as 15 ringgit. Oblivious to the economic and health potential of these trigona bees, the villagers allowed these bees to roam free, building hives within their homes and on anything.
Associate Professor Dr. Siti Amrah also said that the bees play an important role in the balance of the tropical forest through pollination of plants and trees, allowing healthy production of fruits, seeds, and organic honey. With the high concentration of the bees, it has become an asset in assisting the pollination process. So, we share the knowledge based on her research to the villagers.
Based on our findings, after about a year since our initial visit to the village, we noticed that flowers around houses that rear bees has blossomed beautifully compared to other houses that do not rear bees. Evidently, the Trigona bees played a vital role as the pollination agent.
In order to stir interest in bee cultivation, we engaged with Malaysian Agricultural Research and Development Institute, MARDI, and Trigona Bee Sdn Bhd in organizing a talk with the villagers regarding the potentials of rearing Trigona bees.
From this event, 7 villagers were interested to pursue this opportunity. They were taught how to transfer the beehives from their odd habitat into wooden boxes for easy hive control. They too were taught how to harvest this honey and propolis.
The response to the training was encouraging. They showed immense interest in carrying out this small venture. Next, we educated them on the basic bookkeeping and simple cash flow. We introduced to them the basic economics and business concepts.
They have ample space to set up their bee boxes within their home compound. They need not invest in labor, as to care for the bees and their boxes requires minimal supervision, mostly during harvesting or transfer of hive.
Even more, there is no need for intensive investment of capital. The amount they need would simply depend on how many boxes they want. They can either make the boxes themselves or buy them.
As a startup, we received beehive box sponsors, 4 from MARDI and 6 from Trigona Bee Sdn Bhd. The villagers insisted MARDI to come along with them and accompany them to the forest to advise them how to transfer these beehives on their own.
Equipped with the newfound knowledge, hands-on training, and timely monitoring by us and MARDI, 7 villagers, or now the beekeepers, are confident and committed to pursue this venture. We now have a strong rapport with the villagers.
We have successfully witnessed an increase of hives from 4 to 10 and now to 50, which produced a total of 35 kilograms of honey harvested in 2 months. To sum it up, 7 beekeepers have harvested honey valued at 5,220 ringgit.
Within 2 months, each beekeeper managed to sell 12 jars of honey, which contributed to a total profit of 526 ringgit. Previously, their monthly household income was 563 ringgit. So, an increase of 93% in income is indeed a significant improvement.
Due to this successful cooperative venture of the initial audience, 5 more villagers decided to join in. They're currently being mentored by our initial audience. Not only has this venture created a new revenue generation for them, it also has increased their health level and has become an inspiration to others.
Now, on to our second project. The concept of the common citizenship for individuals with psychiatric disability is the same as anybody else: to live, work, and play.
Our point of interest for this project is Permai Psychiatric Hospital, located in Kempas Baru in the state of Johor, the second largest psychiatric hospital in Malaysia. Built in 1973, it currently houses over 800 patients. The average stay of a patient is from 86 to 228 days.
Based on our assessment, together with the hospital rehabilitation program paired up with our training, we derived that these patients needed to be trained and exposed to basic employment soft skills, building relationships, confidence, and spirit of entrepreneurism in order to secure a job or even start their own small business.
This brings us to our solution. We have identified our patients and segregated them to 2 categories of target audiences: training for employment and training for entrepreneur. The aim is for them to be financially independent.
We created 2 modules to cater to the 2 target audience. Module number 1 contains the training that involves grooming, social skills, interview handling, customer service, basic bookkeeping, and business operations.
And as for module number 2, simulation and practical, we set up mock interview sessions and burger stall operation. One-on-one discussions proved to be effective in creating rapport with our candidates. They were more open and they had more questions to ask.
The mock interview sessions has assisted the patients to foresee potential scenarios and feel more confident in conducting themselves. The burger stall is to exercise what was taught and to expose them to the critical thinking of business operations.
With our ongoing involvement with the patients as outsiders, it has increased their confidence level to communicate and relationship building.
This ultimately increases public acceptance, consequently increases rate of recovery.
Technically, These patients contribute to Malaysia's unemployment rate. Every day, the government spends 40 ringgit per patient at Permai Hospital.
That is 32,000 ringgit per day for 800 patients, 960,000 per month, and 11.5 million per year. So, when these patients move out and join the workforce, they reduce dependency on government handout.
Permai Hospital has a department that assists patients in securing employment. Currently, there are 178 patients who are currently working outside since January last year up till May this year.
Monthly, it can be between 30 to 40 recovering patients who are still in the waiting list. Our initial visit began last March. It is during this, the hospital staffs and doctor work closely with us to advise us on how to conduct ourselves with the patients, to respect their sentiments, to understand their routines, their needs, and their conditions.
These became a part of our guidelines in preparing our modules for our target audience. With the help of the hospital administrators, they filtered patients to fit our 2 target audience categories: 2 patients for training for entrepreneurism and 20 patients for training for re-employment.
Candidates for entrepreneurism training were Mahzan and Saiful. They were trained based on a business simulation that we have set up.
That is, to operate and manage a burger stall in the hospital compound, nearby the staff quarters, and accessible to visitors and staff. They are taught about customer complaints handling, sales communication, bookkeeping of daily sales, and day-to-day operations. They're also taught to do their own restocking and reordering of raw materials with a burger supplier.
Meanwhile, the candidates under their employment training were trained on how to leave a good impression during a job interview. Frequent role-playing of interview sessions were conducted to familiarize the candidates and to make sure that they are able to conduct themselves well during the job interview.
Now, a journal entitled Empowerment and Mental Health in Community, Narratives of Psychiatric Consumers or Survivors, has been our reference in empowering our candidates. Exercising choice and control will make them more confident and equip them to be more prepared to integrate with community, simultaneously assist their rehabilitation.
Training for entrepreneurism received a sponsor of 150 ringgit from the hospital to function as their working capital, and Enactus Uniten KSHAS sponsored the burger stall, all of which shall be used for future business simulations of other candidates.
Equipped with this and implementing the training, Mahzan and Saiful have successfully managed to operate the stall on their own. This is to realize a sense of ownership.
All sales proceeds must first consider restocking of materials, repayment of loan from the hospital before they themselves are able to be paid. They operated the stall for 6 days and managed to generate sales of 1,826 ringgit. And of course, they were able to repay their working capital to the hospital.
They each received a salary and profit sharing of 300 ringgit. As of 30th May 2013, Mahzan and Saiful are now no longer in Permai Hospital. They are now fully employed in a factory in Pasir Gudang, Johor.
On to our training for re-employment. We are happy to report that 30% of our filtered candidates have managed to secure jobs around Johor. These successfully employed candidates are now role models to our next batch of candidates. Nothing speaks more than fellow patients they know being true testaments.
In total, there are 9 successful employed candidates. On top of that, we have managed to save public funding. Up till July 1st, a total saving of 6,160 ringgit.
Now, on to our team sustainability. We, Enactus KSHAS, has 2 major annual team events, which is Enactus Open Day and Enactus Team Building and Induction. Total members to date are 261.
During our team building and induction, we have extreme outdoor activities to enhance sense of belonging, leadership, and teamwork. New members are trained to replace graduating ones. They start from the rank of observers, crew members, facilitators, mentors, and eventually project managers or other functional posts.
To sustain our projects, we created structured strategies and adapted to the changes of the needs of our projects. We are guided by our faculty advisors, our alumni, and our business advisory board.
The plight of our target audience Now our friends during our Enactus journey has never failed to amaze and humble us even further.
Working with them has enlightened and made us more grateful for the things we already have.
And for what we have become because of it.
For that, we salute other Enactus teams and their efforts for change.
May all of us create more change for a better future.
And for all.
Thank you, Uniten. You may now begin your question and answer period, judges.
Yes, I have a question for you. I'm Resham Singh. On respect to the bees. Firstly, a comment that recently found out that a documentary in Europe, in France particular, that the bees, they were running out of bees, they were dying because of fertilizer and so forth, and became a country, a nationwide concern of endangered species, and the entire nation has taken action to make sure the bees survive. I don't know whether you're aware the importance of the bees in the whole world. Now, on that issue, from the point which you mentioned, you have got about 35 jars. Have you gone to market further than that on the values of the honey from Pulau Tioman and market in the whole country, and also beyond that collaborate perhaps with New Zealand? They have a royal honey and few other added values added to it that you can collaborate internationally to bring the island to a better future? Thank you.
Thank you for the question. For the future plan to collaborate with other countries, we will, yes, we will collaborate, and I assure that this will bring more advantage to the Mukut village. Thank you.
Good afternoon. On Project REAMP, one of the quantitative outcomes, you managed to reduce unemployment rate within the community by 30%. You said earlier as well that 30% actually got employed. So what happened to the other 70%?
Thank you, sir, for the question. Currently, this patient, they require interest in order to be able to work. So we are currently matchmaking them with other companies, because to match, we need to match this patient with their specific need and with the companies they are about to work. So let's say that if the companies doesn't want want this patient to be like this, but this patient doesn't want to do that work, then the matchmaking process is going to be so tough. That's why we are currently still matchmaking them, and we are ensuring that they also going to get the job that they deserve.
Excuse me. I see the impact on the social and the economic side. Could you explain more on the environmental side?
Sorry, sir. Can you please repeat the question?
I see the impact on the social and the economic side. I'm a bit unclear on the impact on the environmental side.
Thank you, sir. Because in this project, we have seen these people who had been neglected, not only socially, and not only social, but also their families and their friends and their loved ones. So we are currently focusing more towards their economic and social, so that these people can reach into the society even better, and more people will accept them. We are also currently working with Hospital Permai in planting rehabilitation plantation, which is Mahkota Dewa. So this collaboration will soon be on our second phase, and during that time we'll create environment.
You have 1 minute left in your Q&A time.
Just an observation, not a question actually. Your quantitative outcome, 35 kg of honey harvested in 2 months. 2 months is 60 days. It's about half a kg a day. How do you explain that? It's very small. But I thought the figure maybe need to be looked at. Thank you.
Thank you for the question. Okay, for the 35 kg, we get it from the 50 boxes of beehive, and each beehive it's estimated average the bees can produce is around 700 grams.
Thank you, Uniten. Your question and answer time has expired. Judges, please help me thank the team from University Tegana Nasional, Mozam Shah Camp.